few days before, bought the book for him, and the whole thing was a magical awakening. But Bernie Siegel mentions in there that, he's the first physician who ever gave any credence to dreams having any significance. And when I looked back through my dream diary and found that I had dreamed about my dad's cancer the only night I saw him, but oftentimes you dream about yourself, and it may be about someone else. But he had the kidney. It was a left-sided kidney cancer. The kidney's like a brain. It's got a cortex and a medulla. He was asymptomatic totally. It was a shock to everyone. And I'm a junior, so I have the same name as he does. So it was a pretty interesting fit. And then my dad had trained in transactional analysis, and he would use, in the year or two leading up to the cancer, he would say, I'm building up a crud ball of frustration and related to his job as a steel mill executive. And he would gesture right to the place where the kidney cancer was. And a crud ball of frustration, that speaks to some of the German medicine. The other way I'll approach that is through my interest in medical intuition. The first case I ever had demonstrated for me by famous medical intuitive Carolyn Mase I'd met her at the Edgar Cayce Association for Research and Enlightenment. I'd asked her if she could demonstrate what she does, because she does it remotely. And she had written a book with Norm Shealy, who's one of my mentors, famous neurosurgeon and founding of the American Holistic Medical Association. And they wrote the book Creation of Health, which talks a lot about medical intuition concepts. And so I asked Carolyn, we do some research, and she goes, oh, I only work with Norm and Christiane Northrup, and that's about it. And I'm like, oh, okay, whatever. And so I took her number down, and 2 weeks later, I had this MRI scan of a young girl who walked into the MRI scanner in Virginia Beach. She had, the requisition said, like sciatica, leg pain. And when she limped into the MRI scanner, I thought she was faking it to get out of a day of school. That was my crude intuition. Unfortunately, it came from my best orthopedic surgeon. So she got on the scanner, and she has a huge tumor in the left side of her sacrum, which is working its way in the spine, causing nerve damage and all this other stuff. And I was like, whoa. So Carolyn happened to call me back that afternoon. I said, Carolyn, can you show me what you do? She goes, look, I really don't want to work with you. And I was like, okay, maybe some other time. And she goes, I'll take a quick look. She's very gruff, and it's like, okay. And I gave her the name and the age of this young girl. I didn't give her any clinical information, nothing. And there was 5 seconds of silence on the other end of the line. All of a sudden, and she's in Chicago, and I'm in Virginia Beach. She goes, there's a large tumor in the pelvis working its way into the spine. I was like, okay. That was, in Duke basketball terms, that was a slam dunk, and I was pretty stunned, but I managed to stammer out, tell me more. And she goes, oh, this girl has a severe imbalance of the second chakra energy center. It's related to a whole host of things: genetics, her relationship with her mother, family background. And I'm going, whoa. And that was way more information than I had. And then I said, how'd you get that information? So I tuned into her through you, using that spiritual signature of her name and age. And the wild thing was, when I looked at her, I thought the girl was like 10, but the requisition said 13. And when I asked Carolyn for more of an explanation, she goes, this is an immature young girl. She got nailed that one without ever seeing the girl. Immature young girl who would rather die than go through puberty. It was like, whoa. And so talk about a heavy emotional conflict there. She definitely had it. And then I said, that's a pretty heavy trip to lay on this girl. As a radiologist, I always make a differential diagnosis. So I said, it could be a malignant tumor, but it could be an infection or in my heart, I knew it wasn't an infection. It was a Ewing sarcoma. And it was like, yeah, it was pretty straightforward diagnosis. And she goes, no, this is a terminal condition. I'm like, what? And so then 2 weeks later, the girl had a biopsy. It was a Ewing sarcoma. They did nerve damage during the biopsy. She got the wrong chemo and the wrong radiation protocols, as if there was some sort of bizarre death wish playing out. But when I left Virginia Beach a year later, I'd seen her once in a follow-up scan, and she was still alive. I don't have any more follow-up on that, but that was a life-changing experience right there. So.
Well, that blows my mind, and now we're off and running.
Yeah. Okay, good.
So I want to get more into this idea of intuition, intuitive sense. Maybe this is the time just to kind of share our story a little bit, Sean.
Can I share a dream
Since
Oh yeah.
Dr. Burke, you brought up a dream, and I've never really spoken about this. So I had a very vivid dream. It was over, 20 years ago at this point. And in my dream, imagine, in the movie Jurassic Park when they're running and all the dinosaurs are chasing them, they're like almost in
Yeah.
that valley. So I was in this green field, very green. On both sides were mountains, and there was boulders scattered about. And I was with my father, and I looked up in the sky, and we saw a passenger plane, like a 737, kind of teetering back and forth coming towards us. And we turned and we started to run. And we ran and ran, and the plane was getting closer. We knew it was going to crash behind us, and we jumped behind these boulders, and everything kind of wrecked and exploded around us. And I woke up from that dream with this intense nausea. And I went downstairs to the kitchen in the house that I was staying in, kind of got a glass of water, and I had the phone in my hand, and it was probably about 4 o'clock in the morning. And I wanted to call, my parents and just like check in. And just hours after that, our father had died of a massive heart attack. So it was within 6 to 8 hours. I don't know exactly what time he fell asleep. Why'd you never say that? I think I said it like once or twice, but everybody else has their own experiences. But that was just a dream.
Um,
Can
I
tell you what happened to me? No. Yeah.
I like when you say it was just a dream. Yeah, it was more than just a dream.
I'm a skeptical person, and I didn't want to wake them up because it was 4 o'clock in the morning, and it was like one of these things that I would just put off and then check in with them afterwards and just say I had this horrible dream, but that window was obviously too short to have that conversation.
Yeah, and when, those are very common occurrences, more common than you might realize. And I wrote a blog about this called The Spiritual Alphabet Soup of Death and Dying, looking at the 4 phenomena around death. Most people are familiar with near-death experiences. The second is after-death communication, which is like if you had heard from your dad weeks later, that would be an after-death communication.
Well, hold on. There's more to the story that we'll get into. Go ahead. Say the 4 things, though.
And then the nearing death awareness is the phenomenon of people getting communications as they're dying in the month before they die. They get visitations by relatives. It's called the welcoming committee. And that's well documented in one of the most famous TED Talks ever by Christopher Kerr from Buffalo Palliative Care. It's called I See Dead People. It's like 6 million views. And he talks about his research documenting that if people have those experiences at the end of life, they have a better outcome. And now the 4th one is the rarest, and that's called a shared death experience, which is somewhat similar to what you had, because that's something that you're either at the bedside when the person's dying and you go into an altered state of consciousness and experience their death, or you're not there and you are somehow tuned into their death when it's happening. And that happened to me I had an Aunt Betty who was my mother's sister. She'd been a COPD smoker for years on an oxygen tank. But one night I didn't know, I hadn't heard from her in months. One night she shows up in my dream. She's younger than her age at the time. And that often occurs in what we call visitation dreams. And that's where they show up. And then she goes, "Little Betsy's going home," and waves to me and walks away. And I called my mother that morning, just like, and it's like, "Yeah, Aunt Betty died last night." And I said, "Well, she said Betsy, and that doesn't really register with me." She said, "Oh, that was Uncle Walt's pet name for her. He's the only one that used it." And I was like, wow. So that was a shared death experience. So you had something similar to that. Yeah.
Yeah, I did. And I think Roger may. Can you share your story, Roger?
Well, you had more to say on that, so I want to just continue with what you were saying.
No, maybe we'll connect it. I want to hear your story.
All right. So
this was the night before?
So no,
days before?
So there's 2 things. So our father died of a heart attack on his 50th birthday.
Wow.
And I was young. I was in, I guess, my early 20s then, 24 years old maybe. And I was a high school football coach. And working as a juvenile probation officer. It's before I went on my path to become a psychologist.
Nice.
So like I saw him like Thursday before our Friday night game. I think his birthday was like on a Monday or something like that, or Tuesday.
I think it was a Friday. So I think you saw him.
Oh wait, so it was the week before.
Okay.
So it was the week before. He Yeah, now I remember. It was the week before. It was after our game. And I asked him if he was coming to the game the following week, which was his birthday.
Mm-hmm.
And he stopped and he looked at me with the strangest look on his face, right? Like he wasn't going to be here. Right.
Whoa.
And I felt it, right? Like he couldn't commit to doing anything that day. It's his 50th birthday.
Wow.
He was a college football player, All-American, really into sports. So, he would have definitely committed to coming to watch the game that I was coaching in. And it was the oddest experience, but it didn't make sense of it at that time.
Mhm.
Fast forward to the Friday morning,
Mm-hmm.
I'm driving into work and I get shot with energy, like this elevation in mood and experience that felt surreal and supernatural. I didn't know what was going on with me. It almost felt like manic-like, and I became so excited about my day,
Wow.
which I attributed it to the game that night because I was excited just to coach. I love football. Excited about my job that day. Like it was just this tremendous elevation in mood that I've never experienced at any other point in my life. And although I get excited about a lot of things, this was at a supernatural level. I drive into work that day and call him to wish him happy birthday, but end up leaving a message on the answering machine.
Uh-huh.
I later find out, I got a call, that he did die. He had a heart attack. But that exact time frame, the exact moment that I felt that emotion was the exact time of his death.
Mm-hmm.
So that stands out. You experienced something right prior to him dying, and then I experienced that, but we've never talked about it.
No.
Yeah. And
Crazy.
believe it or not, these things are, they're real and they happen. And more, people just don't talk about them enough. Yeah.
So can I tell you, can I talk to you a little bit about intuition? So,
Oh, yeah.
Here's another situation. We talked about this on the podcast. It was February 2020. My father, by the way, was a huge Billy Joel fan.
Oh, nice.
All he did was listen to Billy Joel. Like
Wow.
if we had long car rides or anything,
Yeah.
it became the soundtrack of our life, really. Like we listened to Billy Joel songs. So anyway, during the entire month of February, so it was right before COVID, every time I got into my car, a Billy Joel song popped on the radio. And I was in my car a lot, back and forth to work, picking my kid up at like wrestling practice, taking him to like workouts, a lot of back and forth in my car. Every single time Billy Joel would pop on the radio. So it was so odd. People would pop into my car and I'd say, listen, Billy Joel's going to pop on the radio. I'm turning the station to something where he would not come on, like a Sirius radio. I would put on like a modern station or something else, and then it would come on, right? And then COVID happens, and I end up within maybe that summer, I don't remember, or fall. I wake up out of sleep one day. I walk downstairs and I write an entire email to Sean, my brother, who's sitting right here, living in Los Angeles, California.
Yep.
None of the thoughts came from my mind. I just wrote the entire thing. I never thought about this ever before. It never popped into my head. I never considered it to bring Sean back home here in the Lehigh Valley, Bethlehem, Pennsylvania, to be a part of something that's ahead of us that I don't know if I could have really identified what it was going to be. So I write this really long email to him, and it's about it. He's just about to have a son, right? I think you had a son right after I wrote that.
You wrote it to me. It was 5 days before he was born.
5 days before his son was born, to really invite him here, which becomes the Radically Genuine podcast.
Yeah.
And other things,
And
that,
lots of other things.
things that we're doing. And it took me on a path where I ended up meeting a woman who I guess we can identify her as a medium, or she has those capabilities.
Mm-hmm.
And I ended up talking to my father, and I was a skeptic. This is
Sure.
when I was still asleep. I was a skeptic. So my father ended up talking through her and having conversations with me that only he and I would know.
Mm-hmm.
I never opened my mouth to not give her anything about me because I was a skeptic. And to make a long story short, I met with her probably twice a year for the next couple of years. I usually kind of go every 6 months. Every time I go, she has another message for me and a book to read.
Wow.
One book takes me to another book, to another book. So I have probably read 40 books, listened to channelers, number of things. But one of the consistent messages that has been occurring was she told me there was a guide who works with me with my clients, and then I'm really, really good at certain things, but I'm not helping people in the way that I can. I need to listen. I need to quiet my mind, and I need to listen, and the answers are going to be there for me. They're trying to help me. I'm not listening. They're knocking on the door. I'm not answering.
Boy, that sounds like Dad. You're not listening.
Yeah. And sometimes I am. They said, like, I'm acting in ways that I'm listening to them because I'm not thinking, or I'm acting intuitively. But a lot of times I'm acting based on my learning, what I was taught, what I was told. So I have committed to consistent meditation practice to quiet my mind. In my meditation practice, ideas come to me, answers come to me, podcasts come to me, books come to me, questions that I ask become answered. And I've taken that same skill into my therapy, and I quiet my mind, and the work is done through me. What is happening there from your knowledge of this stuff, like
It's
what
supposed
you've
to
learned?
be easy and fun if you let it happen, So